Hi, I'm Dr. Ogwin, and I would like to thank you for visiting the website and your interest in chiropractic. In this video, what I would like to do is share with you some information on how and why chiropractic can be a safe and non-invasive option for the treatment of many musculoskeletal conditions. Traditionally, chiropractors are known for their work with the spine. So I have a model here, and I'm just going to explain a little bit about what we do as a chiropractor. And as you can see here, the main purpose of the spine is to offer support. It keeps us in an erect posture, protects the central nervous system, specifically the spinal cord, and you can see some of the nerve roots exiting out of there, and we concern ourselves with some of that as well. But the most important thing that we want to concern ourselves with is the motion of this spine, the quality of motion, the function of the spine. So you can see, looking from a front view here, you can see all of these vertebral bodies is what they call these, and the spine is made up of individual bones called vertebra. We have discs in between each of those. These discs act as shock absorbers and as another joint to really give us this wide variety of movement that we have. If we flip this around and look from the back, this would be coming in this way here. We can see that there are joints on both sides. Now there are 24 vertebrae, joints on both sides of those. We have what they call the sacroiliac joints because we have our sacrum, our ilium. Some people call this the hip. This would actually be the hip right here. This is the ilium, the sacrum, and they call that the sacroiliac joint or the SI joint. We have the base of the skull here, which is called the occiput, and we have an articulation with the base of the skull in the first cervical vertebra, which is the atlas. All of these joints, there are over 50 joints in the spine. Now, when functioning properly and in unison, this allows for quality and dynamic motion. The problem is that in a lot of people, especially people with low back pain, mid-back pain, neck pain, headaches, there are restrictions, there's tension, and there's misalignments somewhere along this chain. This throws off the proper biomechanics and it leads to pain and an increased risk for injury. So as chiropractors, and what I do to address this is spinal adjusting. I do myofascial release and trigger point therapy. This is muscle work. And I do functional rehabilitation. Now, I'm going to talk about the spinal adjusting in the next video. I do want to mention, though, that the muscle work, the trigger point therapy, the myofascial release, some of the stretching that we do addresses the muscular component. And you have to understand that the muscles move the bones. So if we don't address that, it requires a longer time to heal and a longer time to fix the underlying problem. And again, the same thing with the functional rehabilitation. I point out the imbalances for patients, and then I teach them how they can maintain balance in their body by doing specific stretches and exercises. And this just allows for a greater recovery time. So please, if you would like to learn more about the adjustment, please go on to the next video, and I'm going to explain a little bit more in depth on what the spinal adjusting has to offer.